Hello, Dr. James Bogash, expert in health and longevity, and a topic I've covered a lot over the years, and I'm really pretty strongly against is testosterone replacement therapy, both for men and women. But this study really just kind of drives home what the real issue is. And the thing is that we look at testosterone as the problem instead of looking at it as the marker. No different than cholesterol. If somebody's cholesterol is elevated, it's not the cholesterol that's the problem, it's the lifestyle that's driving the cholesterol. And so there are things like prediabetes, metabolic syndrome that absolutely drives low testosterone levels. So I picture like the overweight guy on the couch drinking beer, eating potato chips that sees the commercial on TV about, hey, like your low energy is from your testosterone. Well, no, it's because of the choices that we're making. And this study, again, drives that home. It was a review study looking at multiple different studies, looking at men aged 17 to 70, 9 studies looking at over 12,000 men. And one of the important things that they found was there was a nonlinear decline with age. So, in other words, until you hit age 70, age was not really a factor in low testosterone. So, if you're 45 and your doctor tells you have low T and that's the problem, it's not the problem. It's an indication that there is a problem, but adding T will not fix the problem. So, looking further into this study, they looked at what was associated with, first of all, BMI. So higher BMI meant lower testosterone. Being married, lower testosterone, interesting one. At most 75 minutes of vigorous activity per week actually at most led to effects on testosterone levels. I'll talk about that in a second. Smokers, former smokers, lower testosterone levels, not a big surprise. People with high cholesterol, with high blood pressure, again, all signs of prediabetes. Diabetes, you've passed the prediabetes, you now have the label of diabetes, and men with cancer. All of those are not unexpected. The other thing that's a factor is environmental exposures. So a lot of our BPA, our phthalates, all those wonderful smells we have, you have to have your dryer sheets, all of those are estrogen based, so they interfere with testosterone production. So the reality is if somebody has low T, then you need to look at why we're having low T. And prediabetes is the first one to go after. After that, we need to look at our chemical exposures. We need to, if you're doing, like making sure we're doing weight training. If you are, maybe consider things like blood flow restriction training. But don't accept the fact that just because you're 50, so I'm 54, I would have no concern or issue with needing testosterone replacement. If you're 50 and your doctor tells you you have low T and that's the problem, maybe it's time to find a new doctor or maybe do some research on your own and find out what the real problem is. Why do you have low testosterone? It's not the low testosterone is not causing your problem. Whatever is causing the problem is also or whatever is the problem in your lifestyle is also causing low testosterone. We need to get that thought process out of our brain. And the fact that there was a nonlinear decline in testosterone based on age in this study really supports that idea that just because we're older does not mean that low testosterone is a given. If you're over 70, maybe, but in general, that's not the answer we need to go with.